I will be covering the Celf 5. Celf stands for Clinical Evaluation of Language Fundamentals, the 5th edition. So, what does the Celf do? Well, the Celf is a standardized assessment that looks at various areas of language, whether that's semantics, syntax, grammar. It's normed for individuals between the ages of 5 to 21, and it's divided into two groups, 5 to 8-year-olds and 9 to 21-year-olds. It's primarily used by SLPs to diagnose language disorders. It can help with determining eligibility for services, whether that's in the educational setting or the school setting, private practice, and it helps with goal writing and treatment options. So, depending on which areas the client score is low in, will help the SLP figure out where they should start with treatment and what goals to write. Each age group has different subtests that it looks at. So for ages 5 to 8, it looks at things like sentence comprehension, we have some word structure, following directions, recalling sentences, pragmatics, and others. And for ages 9 to 21, it looks at things like sentence comprehension as well, word structure, following directions, understanding spoken paragraphs, pragmatics, and more. And for ages 8 to 10 and 11 to 21, reading and writing are assessed through reading comprehension and structured writing. However, from this presentation, I assessed my client using the formulated sentences, recalling sentences, and sentence assembly subtests to get her overall expressive language index, which is the things or what she can say. What goes with the Celf and what is usually done before the Celf is an observation rating scale, or an ORS. This is a form that teachers, parents, or caregivers can fill out, and it's regarding the client's everyday communication. And it's rated with never, sometimes, often, or always. So, do they have trouble paying attention? And you would check off what you feel is appropriate for that question. This addresses listening, speaking, reading, and writing. And what's great about it is it provides much more information than you may get from just an assessment. In addition to the ORS, we have the pragmatics profile worksheet. And that's something, again, that caregivers, teachers, parents can fill out. And this looks at the way the client socializes or interacts on a daily basis. So it looks at things like taking turns in conversation, navigating a conversation, understanding and using nonverbal cues, and others. And this is also a rating scale. It's 1 through 4. So never would be a 1, sometimes would be a score of 2, often would be a 3, and always or almost always would be a 4. The most important score of the Celf 5 is our core language score. So this is the overall measure of what the client is able to do with language. It's a combination of some scaled scores from 4 different subtests. Again, we have 2 record forms depending on the age of the client, and each record form looks at different things, and you get the core language using different subtests. And then I've listed different subtests for each age group that will give you that score. We also have 4 other important scores, which are our index scores. So our receptive language index score, what do they know? Their expressive language index score, what can they say? Their language context index, and their language memory index. And that's going to be what can they recall? What can they store? How long can they store it for? The average range on this assessment is a scaled score of 85 to 115. So anything below that 85 can cause a little bit of concern and can indicate a language impairment. When it comes to the validity, the reliability, and the bias of this assessment, even though the Celf 5 is one of the most widely used assessments to identify language disorders, it does fail to meet the standards. Some of the things that can affect the reliability of the assessment is the way it's administered. Some people administer it in different ways. Child performances are inconsistent. Some children are hyper and they're not really answering it the way they should, or they're bored and they're not trying. It is normed for English speakers. So if you don't speak English or it's not your first language, that can skew the results. And it's not the best at monitoring progress over a long period of time. Some of the bias include racially, culturally, and socioeconomically bias. And this can make it hard to determine if a client really has a language disorder or maybe it's something else. Who can administer it? So it can be administered by anyone who has been trained to give this test. Usually that's our SLPs, our psychologists, and our qualified diagnosticians. So how it's administered, It's going to have a couple requirements. You need your 2 stimulus books, you need your examiner's manual, you need your response books, a pencil, and one of the 2 record forms, which again depends on the age of the client. The SLP will administer an item that correlates with their age to establish a basal, which is the number of correct answers consecutively. Usually you need 2 to 3. And then they'll continue to administer the test until a ceiling is reached, which is the number of incorrect answers consecutively, which is usually about 4 or 5. Some subtests will allow you to repeat the question and some do not. And the clinician must start the item that correlates with their age. Now, if a client answers incorrectly prior to reaching that basal, the clinician must go back to item number 1. So for my client, I wanted to look at her expressive language index. So I had to give her 3 subtests that correlated with her age, which was 12. We looked at how she formulates sentences, how she recalls sentences, and the way she assembles sentences. Now, again, the clinician must refrain from giving specific feedback to some responses that the client gives, and it's important to always encourage your client. So for the first subtest, we have formulated sentences. This is where I'm going to give her a picture to look at in a word, which was reading in this case, and she must create a sentence looking at that. Here is a picture of people in a library. I will use the word book in a sentence to talk about this picture. The girl is reading a book, or I could say a book is on the table. Here is another picture. Now you make a sentence about this picture using the word reading. You must make your sentence about something in the picture and you must use the word reading. Look at the picture to help you think of what to say.
The man is reading a newspaper.
Okay. Next one is before.
The man is paying before the woman.
The word is instead.
He wants dinosaurs instead of trunks.
Here is a picture of people in a library. Next, we have the recalling sentences subtest, which is where I will read her a sentence, and she will have to repeat it back to me word for word, and I'm not allowed to repeat the sentence. Okay, so I'm going to say a sentence. I want you to listen carefully and repeat what I say. So let's try. My sister is in 6th grade.
My sister is in 6th grade.
Perfect. Listen to another sentence and say exactly what I say. Does Mr. Gomez teach reading?
Does Mr. Gomez teach reading?
Perfect. Okay, let's try some more. Remember to listen carefully and say exactly what I say because I can only say it one time. You can't repeat. All right. The boy bought a book for his friend who likes short stories.
The boy bought a book for his friend who likes short stories.
The computers and printers were donated by the school board.
The computers and printers were donated by the school board.
Okay. If the rain doesn't stop before noon, the field trip will have to be canceled.
If the rain doesn't stop before noon, the field trip will have to be canceled.
Okay, the class that sells the most tickets to the dance will win a prize.
Nope, I don't remember. I don't remember at all.
Okay, so the next subtest and the last subtest that I gave her was sentence assembly. This is where I give her a few words and she will have to create 2 different sentences using those words. All right, here are some words that can be made into 2 different sentences. Tall, the boy is. The boy is tall. This sentence tells something. That's one way of doing it. Here's another sentence with the same words. Is the boy tall? This sentence asks something. Now, I want you to try it. Make 2 sentences using the words I show you. Saw, the girl, the boy. Use only those words.
The girl saw the boy.
Okay, nice.
The boy saw the girl.
here are the teacher assigned homework and didn't in 2 sentences.
The teacher didn't assign homework. Didn't the teacher assign homework?
How the Celf is scored is the clinician calculates the raw score by tallying and adding up the client's total responses. The clinician then uses the manual to convert that raw score to a scaled score, which is the client's performance in comparison to the normative sample. And with these scores, the clinician can determine the percentile rank, or those who have scored the same or lower, and the age equivalent. All of these scores are super important when determining a client's eligibility for language services. Some groups that are not suitable for this test are clients with attention difficulties, challenging behaviors, like I said before, those who don't speak English, clients with intellectual disabilities, clients who are hard of hearing, and anyone below the age of 5 and above the age of 21. My client did score an 87 for expressive language index, so she was within the average range. And I also just kind of posted a little picture of the assessment process and how it goes. And that is the end.